Hi, my name is Josephat, a clinician with Taskpen. I would like to talk about a very interesting topic, and that is dyslipidemia, one of the NCDs that Taskpen is focused on. Now, dyslipidemia is known to be an abnormality with the lipid levels in the bloodstream. Now, lipids, yes, lipids are fats. It is important to note that the lipids that we are talking about are cholesterol and triglycerides. There are bad lipids and good lipids. As Taskpen, we try to make sure that we look into the bad lipids that are causing a lot of cardiovascular diseases and also strokes and heart diseases. Now, what are the causes of dyslipidemia? The causes of dyslipidemia can be classified together with the characteristics of dyslipidemia. So dyslipidemia can be characterized as primary or secondary. Primary dyslipidemia is inherited dyslipidemia, runs in the family, deals with genetic mutations. So when it comes to secondary dyslipidemia, we are talking about an acquired type of dyslipidemia, which involves, number one, lifestyle. Lifestyle talks about what you eat, what you drink, and smoking excessively. We also talk about other medications. There are medications that can cause dyslipidemia. A type of medication that is prevalent to cause dyslipidemia are ART medications and corticosteroids. There are other medical conditions that can also cause dyslipidemia. An important one to note is diabetes, hypothyroidism, and also having conditions like chronic kidney disease and liver diseases. We also know that all these are a subset of HIV/AIDS, which is a common disease that each and every one of us know about. It is important to note that dyslipidemia has a high prevalence in people living with HIV. And it is important to also note how we'll be able to identify this dyslipidemia. Now, the best test that is there to identify dyslipidemia or to diagnose someone with dyslipidemia is a full lipid profile. In this full lipid profile, Taskpen is looking at the LDL, which is the low density lipoprotein. Now, this is the bad fat. It is important to note that when someone has a high lipid profile, or rather has a high LDL of about 3.4, someone will be diagnosed with dyslipidemia and will be started on medication. The preferred medication is atorvastatins. Those are statins which lower our lipid levels when high. It is important to note that there are ways in which we can prevent dyslipidemia. Now, we can prevent dyslipidemia by changing our lifestyle. Changing our lifestyle involves, number one, the food we eat. If we reduce unsaturated fats like chicken skins, fried foods, those are fast foods of course, and of course if we can be able to also on the other end look at alcohol intake. If we can reduce our alcohol intake, it is important that dyslipidemia will be prevented. Another point that we can look at is smoking. Excessive smoking will cause dyslipidemia. Other things that we might also try to look at are taking our medications. If we are able to take medications as provided or given instructions by our doctors or clinicians, we will be able to control the levels of dyslipidemia, or rather the levels of lipids in our body. So in conclusion, when you are diagnosed with dyslipidemia, you can be able to monitor your lipid levels according to your doctor's discretion. Now, this has been Talking with Taskpen. This has been the episode about dyslipidemia. I am Josephat, a clinician and Taskpen. See you in the other episodes.